What are the stories of impact and ingenuity that are transforming our cities? Join us on the Urban Q, where we talk about tackling urban conundrums and celebrate stories, ideas, and people that help us create better cities for all.
Hello, everyone, and welcome to the Urban Q. Today I have with me Rosamund Adoo-Kissi-Debrah, an educator, the founder of the Ella Roberta Family Foundation, based in London, and a globally recognized advocate for clean air action. As a WHO advocate for health and air quality and a Breathe Life ambassador, her work with communities, policymakers, and global institutions to secure clean air as a human right has been recognized with numerous honors, including the European Lung Foundation Award in 2022 and being conferred a Commander of the Order of the British Empire in 2023 for services to public health. She is a practicing research fellow at Imperial College, an honorary fellow at Goldsmiths University of London, and has received a Doctor of Science at the University of Southampton. Her future focus is on raising awareness about the under-recognized, complex, and long-term implications of air quality. Welcome, Rosamund.
Thank you very much for having me.
Thank you for joining us on the podcast, The Urban Q. All right, so Rosamund, I'm going to start with your advocacy and how that began. So your advocacy for clean air began from a deeply personal tragedy. Can you share your experience and how that led to the creation of the foundation?
Yes, very much. It's Ella died in February 2013. Her death was very, very complicated, very medical. So it wasn't until September 2014 she finally got the first inquest. And at that inquest, it was the first time we heard that her triggers were to do with something in the air. During Ella's lifetime, this was not even a conversation. We were always looking at something bio, something to do with her body, genetics. That's what we were looking at. And what happened from there? So that was September 2014. She then had a child death review, which happens to every child who dies in the UK suddenly, has a death review. So they got the information from the inquest. So we knew her triggers were to do with something in the air, but we didn't know exactly what. Something in the air could be anything. So I did an interview for my local newspaper. And I actually put it out there. I said, you obviously, my daughter has died in 2013. It is a year on plus some. Can anyone help me get to the bottom of this? And when you put something out, you know you're going to get responses, don't you? I mean, some people contacted me and said, it must be the dairy, she's eating, all sorts of things. But there was one chap who said to me, you need to have a look at the air pollution around your area on the night that she passed away. And I have to confess, I didn't take it that seriously until Ella's lawyer, a friend of mine had worked with her, and she saw her asking for people who had been impacted by air pollution to come forward. So I contacted her. Pardon me. I went to see her with my story, and she said to me, "Leave it with me. I need to investigate it." Obviously, I gave her permission to get all of Ella's medical records, and one of the things she put together quite quickly is she had a look at all the times Ella was admitted to hospital. Ella went to hospital 28 times in 28 months. But one of the things Jocelyn began to see, there was a pattern. We had monitors near where we lived, and what became very apparent is every time there was a spike in air pollution, that's when Ella's lungs went down and she was admitted to hospital. Obviously, during her lifetime, when you rush a child into hospital with breathing difficulties in 2010, 11, 12, and 13, you are basically, when your child is barely alive, when you got to hospital, all you want to do is a doctor to save them and resuscitate them. You are not looking at air pollution. And for me, it wasn't something I knew about then. Obviously, since her death, it has become a lot more worldly known now.
No, thank you very much, Rosamund, and for sharing that. I know it's very difficult. But how do you think personal stories like yours play a role in raising public awareness and informing policy on air quality? How did that pan out?
Well, we all have to breathe air. Without breathing air, we will only survive for 2 minutes. And scientists have been looking at this. Our expert witness in our case, Sir Stephen Holgate, has been looking at this for 40 years, but he was struggling to get the message across. Ella now brings a human face to this.
Hmm.
And that's what's changed things, I think, that people can relate, and where we live, last year even, 8,218 children were admitted to hospital with breathing difficulties. So that hasn't stopped with just her. It is still ongoing. And you have horrendous problems in India. So
Yes,
this is a worldwide issue. WHO say 91% of the planet we are breathing dirty air. So this impacts um, so many people, and every year 7 to 8 million people die prematurely across the globe. So this is a worldwide issue. This is not just a UK or an India issue.
right. No, absolutely. And you talked about the that you're doing with UN in terms of the recognition of clean air as a human right, and that's a powerful milestone. So, what does operationalizing this look like in practice, especially when you consider 99% of the world is breathing poor air as per WHO standards? And how do you stay motivated when the kind of progress that you want to see remains quite slow?
Progress is slow, there's no doubt about it. We need to be very honest. Why? This is really about fossil fuels, let's be honest. And fossil fuels make trillions. And I think the question we need to ask ourselves, what is in her life? What is more important? I even hear from my own government, and I can focus on the UK because that's where I am born and that's where I live with my children. The obsession for growth of economies, we all know about this. And even even the UK, the frustration that our growth is not where it should be. And you hear health ministers talk about people being ill. They want to get people back to work and the growth. I will urge them, as the coroner did, to have a look at the reason why the population are ill. How much is dirty air contributing to it? The reason why I say that is we now know, and we will continue to get more research, that air pollution is linked to 700 diseases. In the UK, 30% of lung cancer cases are down to air pollution. 20% of strokes are down to air pollution. We know we found particulate matter on the brain of dementia patients. We know children have stunted lung growth. We could go on and on. So I urge all governments, if you want a healthy economy, and by the way, you are paying trillions in healthcare, you would be better off diverting some of that money into cleaning up the air. People's quality of life will be better, and you will also get a much healthier workforce. They can't get around this, by the way. They might have tried to ignore it, but it is something that is not going to go away. My question to all governments is, how many need to die before you do something? How many need to be disabled before you do something? And for me right now, I find in the UK, there's a lot of blame. Mental health, this and that, it's all people's fault. And, it is as if we haven't learned anything from COVID. COVID was airborne, so is air pollution. And look at the damage COVID did. So it's staring them in the face. And I feel as governments, they have a duty of care to their citizens. And I think we citizens, we need to use our democratic power to vote people out who do not put our health and our well-being first. That is my message to people. So when people come knocking on your door during election time, one of the things you can ask them is, what are you doing about my health? And if they say, what do you mean? You say, well, me breathing dirty air is stopping me from putting food on the table for my family. I think we need to start making the connections, and we need to be, because we know these people want our votes. So if they want our votes, then they need to look after us. And all governments, by the way, they have a duty of care to look after their citizens and cleaning up the air. The same way, clean water, clean food, having shelter, a roof, these are all our human and basic rights, actually. And that's why we want to make clean air a human right at United Nations. This is something all governments should recognize. This isn't too much to ask for, no.
No, absolutely. And you made a very important point about it's not just about how air quality impacts, your health or, mortality numbers, but about how it impacts the economy, for example. And we know that it impacts everybody, but we also know that it particularly impacts children, low-income communities, a lot of whom earn their livelihoods outside, and people with existing health conditions. We, like you've said, we see this problem in India, we see it across the globe. Is there any advice that you can offer on how India could work towards ensuring that its clean air plans, and we have quite a few, are fair and inclusive, especially for children and other vulnerable groups?
Well, one of the things I have learned on my journey is 65% of the air pollution in the UK was from transport. So anyone who lives near an incredibly busy road, you are exposed to it. I do not know the situation with India regarding diesel. We went down the diesel route and we have now found that was lethal and toxic. I can talk about the UK because I know that air pollution cost the UK economy 27 billion, and our AQI is nowhere near yours. There will be people who can make the economic case, and I think that is another way to appeal to governments, not just the health impacts, but the economic impacts. I think 27 billion is being conservative if you add in dementia, and the reason why I am adding that in is we found PM 2.5, particulate matter, on the brains of dementia patients. You suddenly add in dementia, and that bill rises to 50 billion a year. And any chancellor would definitely take note of that, something that is costing the economy. So I don't think making the health argument is good, but I think we need to make the economic argument. We need to speak the language of government. And we know government, they are about growth. And whilst people continue to be ill physically and mentally, it is costing the economy dear. If people can't work, it will affect the economy. And we spoke beforehand about the detrimental impact air pollution can have on every organ in the body, the nervous system, the brain. We know about the lungs. And look, unhealthy children should be a warning, equals unhealthy adults in the future. You
Right.
get diagnosed with asthma. Asthma is a lifelong chronic condition. There is no cure. So it is in government's interest to make sure children are as healthy as they can be.
No, you've done a wonderful job of situating it in the context where the stakeholders, understand it as per sort of their concerns and their language. And making the invisible visible is a challenge. You look at dirty water, you can see it. It's like, oh, this is not clean, or you see some place, a piece of land that is dumped on. It's very visible. I think air quality is an invisible challenge. And when we talk about our cities, we have normalized air pollution and we sometimes see it as a seasonal challenge. You've mobilized public opinion and influenced legislation. So, apart from building the economic case, what have you learned about building political will in democratic systems where the harms may be invisible, delayed, or normalized? And how can communities maintain that demand for change over time and throughout the year not just the 3 or 4 months where the AQI is really bad?
I think I tend to young people here because I think young people understand climate change, they understand air pollution, they understand what I'm talking about. They are the same young people with asthma. Luckily, when we next have a general election, 16-year-olds will be able to vote. Those 16-year-olds are now age 12. Part of my role going forward is to educate them about their health. And in 4 years' time in the UK, when they come to vote, yes, we vote because we want housing, we vote for money in our pockets. But one of the things that we need to also look at is their health. It is taken for granted that young people do not vote. My message to young people listening to this podcast, I know you've seen what has happened in New York with Zoran. I know you have, because of social media. The world has become smaller. And one thing Zoran has shown is when you mobilize and you actually go out there and you vote, you will get results. And you know about the climate crisis. I'm not going to sit on here as a teacher and patronize you. I know how much young people have already mobilized themselves. What you now need to do is go out there and vote. Do not fall for that thing that, oh, our votes don't count, they don't matter. I saw before COVID, Fridays for Future, how much they mobilized globally. Now, what I want them to do all over the world, when elections come up, vote, use your vote, find out the policies of these parties. Don't allow people to do lip service, just say, oh, climate change, yeah, we'll do something. What are they actually going to do about it? I would like to see change all over the world before my time is up. Let's hope I get it. And that's why I continue to campaign. As a teacher, I continue to have hope. I believe we will get there. It is slow, and the amount of people being ill and dying, it is never going to be acceptable. But if I didn't have hope, I wouldn't be on your podcast now asking young people to do something about it. See, as the teacher, you know how phenomenal young people will be. It's very, very, very important. My daughter would have been 21 for today, 21, and she should be a thriving member of society, and yet she is dead. So when people say to me, oh, what about the jobs? What about this? If you're ill, you cannot work. And we've spoken about serious illness, not just asthma, that every organ in your body is impacted by air pollution. And we take it for granted until it happens to us. We need to, and every single country has an issue with air pollution and has premature deaths. And we need to force our governments to take this matter seriously. They aren't going to take it seriously until they know we're not going to vote them in. So that's what I have learned. Votes matter. And when it comes to health, you need to make your voice heard. Economy matters as well, because we need a thriving economy to pay for our health service. And if a population is ill, you aren't going to get that thriving economy. And we need to look at the poor, those on lower income, the marginalized. They don't even contribute to this, and yet they suffer the most. It's a travesty. Poor people take public transport. It is the same everywhere. There are some things, no matter what country I'm speaking to, it is the same. When you look at the UK, a poor person will not own an electric car. They'll either walk or they will be on the bus. They can't even afford a train. Our trains are one of the most expensive in the world. So they're not the cause of this, and yet they suffer the most. We have to change that. We keep on talking about it. Let's have some real change.
Now, that is such a powerful message, Rosamund, especially about how do you educate children about their health so that when they go out and they're making life decisions, when they're making decisions about their government, the governance that they want to have, that they can do so in a very informed manner. And that way, these topics, which have been under the radar, gain political salience, which they so desperately need. So thank you for that. Now, coming to my last question, it's a two-part question, really. And as we're seeing urban areas grow and climate impacts intensify, cities have to ensure that decarbonization and public health agendas stay aligned. And that's a lot of what you've also been advocating for. Is there any city in the world that is getting it right or that has got it right? That's the first part, and then I'll come to my second one.
I think we need to look at Scandinavian countries.
Okay.
I think we really do. The reason why I say that, there are some years when they have zero deaths from asthma. So we need to have a look at what Scandinavian countries are doing. And I think I think Sofia as well is just won an award. Is looking at the public transport. So I think cities, we can make our buses cleaner. Remember I mentioned diesel. Diesel basically needs to be phased out
Mhm.
the world over, basically, not just in the global north. And that applies to the global south. What we've learned about diesel, my advice to the global south would be, do not accept any diesel vehicles from the global north. They are not going to do your health any good. If they're bad for the global north, they're bad for the global south. And look, we know in urban areas, this is where the jobs are. People move to cities to work. That's why people move to cities. That's where the jobs are. And people shouldn't feel guilty to say, oh, I live in a city, therefore it comes as part and parcel of it. No, politicians need to do something about it, and they can. In the UK, we have the biggest clean air zone in London, and it has lowered nitrogen dioxide by 50%. It is still, and in not in everywhere, but in most areas, that it has reached the legal limit, but there's more to do. But what that shows you is this is about political will, that we have a mayor who was brave. There was a lot of opposition against him, but
Mhm.
he realized, look, in COVID, and it's worth mentioning, the reason why I mentioned COVID, in case people haven't connected, in areas of high air pollution, more people got COVID and got them severely, and more people died. We lost over 10,000 people just in London during COVID. So it is only right that a mayor who cares about the health of their city you know, politicians like to be popular. What I do in public health, it is not popular.
Mhm.
But being a politician should be more than being popular. You have to do the best for your city. And people were saying to Mayor Khan, oh, people are not going to vote for you when you implement this. His vote actually went up. And
Yeah,
we still have a problem in London. I'm not going to sit here and pretend it is all solved. And we continue to push him to act further. And with cleaner air, you'll get a thriving economy. And that makes us all happy, doesn't it?
absolutely. And I think that's a very important message that, a lot of this is going to require action, which is going to be unpopular. And so, you have to have brave, bold actions, which are not going to please everyone, but that's what it's going to
Very,
take.
very much so. And I think sometimes a lot is asked of the individual. The
Yeah.
individual can only do so much.
Uh,
And when it comes to clean air zones, individuals can't do that.
well,
And we have shown in London, I think we're now going to uh, Oxford Circus, which many people may know is in our city centre. At some point there will be no cars in there, and we hope what we eventually see will be lots of people on foot eating at restaurants, shopping in shops. I have a lot of hope for my city, and it's up to cities. And we know mayors of cities, C40, they have powers, they can do something about it. And they should. So all the cities who are part of C40s, they need to have a look at what London's done. Although it's not perfect by any means, it is a start.
yes. No, absolutely. You just a little while ago, you just said that, individuals can't do much, but I'm going to end our podcast on that note and with that question that at an individual level, how can we make a difference? You did say, vote for the
Yeah,
right.
they can do something, but ultimately,
Yeah.
when you're looking at things like construction, and we look at I mean, my daughter died from outdoor air, but now we know since COVID, indoor air. So
Yes.
we know that when governments are building housing in future, they need to make sure the houses indoors are healthy homes. They are reaching the right standards. They don't have mold and things like that. And that may be different in India being a hot country. But what I'm talking about is um, we looked at people's driving abilities in the UK, and a lot of journeys were being done under a mile by car, which is not
Mm.
necessary. Those
Yeah.
are journeys people can walk.
Yes.
My son this morning, is his bicycle here? That means he went by train, but he cycles to university quite a lot. I think it's quite damp, so he's decided to get the train, but he cycles quite a lot, and they have extended the cycle lanes in the UK. So I think what we are saying to people is where they can, and I do factor in, I always have to remember that my daughter was disabled when she died. And I'm not saying this of people who are disabled. I am not asking disabled people to get on bicycles. I have to make that very clear, because sometimes when you listen to these podcasts, it might come across like that. And also in the UK, I don't know whether India is similar. When you live in rural places, the transport isn't as good. So therefore, people rely on their cars more. And that's a government thing. So I'm sure people in rural, if they could take buses or other means of transport, they actually would. But that's not always available to them. But in cities, a lot of the time, for instance, I haven't driven into central London. Oh, Ella will be 21 now, so yeah, maybe for about 23 years. I've always got the train into central London because there is no point when you're going into city. When I get on the train, I am there in 17 minutes. To drive, I don't know how long that would even take me. So I would rather take the train because it's quicker and it's more efficient. And those are the things we, as individuals, we can actually do. Do not buy a diesel car.
Mm.
Um, and also, the other thing I looked up is how to get food into shops. Big lorries and diesel, could they change them to electric vehicles and smaller ones if it's more efficient? There are many things governments have to do. We have to do our bit as well. But I think we look to governments to lead, don't we?
Mhm.
And I think it's very disingenuous to put all of this on the individual. I think
Mhm.
individuals will always do the best they can, but we need the the actual real infrastructure change, the massive changes, like changing buses from diesels to electric. That's got to be done by governments, and that's what we are asking for.
Right.
Just add one thing.
Sure.
After having the health summit 2 weeks ago, and
Mhm.
from my daughter's inquest, one of the so two things I need to harp on, and hopefully you are able to cut it in. What the coroner discussed was there needs to be more education on this topic.
Yes.
So public health campaign we are asking for in the UK, that could be worldwide. And there
Mhm.
needs to be more monitoring so
Yes.
people know what they are breathing. But one
Yeah.
of my biggest thing was the third one, was that medical doctors, health professionals everywhere need to educate themselves. So
Mm.
all the way from medical students to a professor at the end of their career, if they're still practicing, is to educate themselves on air pollution and the impacts. The medical establishment have got a lot to add to this. We, as public health advocates, can do our bit, but I think medical doctors are quite important because they see their patients and their patients trust them. And
Yeah.
we would like them to talk about this particular topic. If you live in an area of high air pollution, and your doctor sees you, a pediatrician sees you're coming back to hospital again and again and again, it is
Mhm.
worth their while to find out, is it the pollution where you live that
Yeah.
is making you that ill? And
Yes.
what advice or what help or can they give you to make your life easier? So we all have a stake in this. It's
Mhm.
not me or you. We all do. Governments, individuals, medics, everyone.
And thank you for spotlighting the need for data to make the data visible,
100%.
monitoring, talking
If,
about
well,
those.
if you want people to change,
Yes.
sometimes change is difficult, and people need to know
Yes.
why you need to change
Yes.
things.
Yes.
Having data and people should, governments or mayors shouldn't be scared to show people, look, the air is dirty. Have
Yeah.
warnings up.
Yeah.
This is a high air pollution area. So, if you can not drive for today, please do so.
Right.
Yeah, I think behavior change is incredibly difficult in my
Yes.
career. I started with a psychology degree, and I know behavior change is incredibly difficult, but at least give people the information.
Yes, so that they can, if they want to, make those changes.
Absolutely.
And awareness, like you said, awareness. I think that is key to so many things, campaigns then can help in that area. And the spotlight on medical professionals and all medical
100%.
to be
Please, if you would do that for me.
yes,
And
think
this
about.
doesn't just apply to the UK. The
Yeah.
coroner's verdicts could be read in any country.
Yes.
And his recommendations, if people follow just those three recommendations, our health and our economies will be stronger.
Well, wonderful, Rosamund. This was such a wonderful conversation. Thank you so much for your honesty, for being so forthcoming with all of your experiences, the wonderful work that you're doing, not just now in the UK, but globally on sort of transforming the conversation around air quality and the champion that you are for that.
Well, thank you very much for having me. It's been the ultimate pleasure. I have always wondered what it's like to live in a country with an AQI, which I can't even imagine. So it is amazing to see you all remaining so positive and advocating for the people in your country. And I'm deeply grateful that there are people like me everywhere trying to do the best in public health. And it is lovely to meet you all.
Rosamund, it's been an honor, and thank you so much for this honest conversation. And I look forward to remaining
Thank
in
you for the
touch.
platform and goodbye and thank you to all your listeners.